Good morning. Hi there once again. Dr. Krish Bab here. The face is a wonderful creation. The sensations of the face are also wonderful. The lips, the nose, the eyes, the entire contour is a very sensitive area. The sensations are carried out by special nerves from the face, which help us appreciate the various forms of sensations. Pain, hot, cold, fine touch, crude touch, feather touch. We are able to relish all types of foods with the help of biting and chewing mechanisms. These are also controlled by some nerves which supply the face. So the wonderful sensations of the face as well as biting and chewing are commanded by one nerve called the trigeminal nerve, the fifth nerve in the list of cranial nerves. Trigeminal. On both sides it is there, gemini and trigeminal. It's got three divisions. Formed inside the brain, it divides into three divisions and comes out through devoted foramina. Superior orbital fissure, foramen rotundum, foramen ovale. We have all learnt about it in osteology classes. Basically, the three divisions come out through these respective foramina. They are the ophthalmic nerve, maxillary nerve, and the mandibular nerve. The ophthalmic is in charge of the upper third of the face and the medial aspect of the face. The maxillary, the middle third of the face. The mandibular, lower third of the face, and goes posteriorly, its representation. The ophthalmic nerve in turn gives three branches. Remember, it has NFL, nasociliary, frontal, and lacrimal. Together they supply the medialmost aspect of the superior third of the face. So it's a purely sensory branch. Then comes the maxillary, which is also a sensory branch purely. It supplies the middle part of the face, as I told you earlier. A lot of branches are there. It's very difficult to remember. Yes, it's very difficult to remember. But if you visualize what it is going to supply, what are the organs present in the middle third of the face, we can derive most of the time the branches as well. We got the inner aspects of the nose, the palate, the upper jaw, and the middle third of the face, outer aspect. So the nerves also can be accordingly. All sensory branches only. Zygomatico-temporal, zygomatico-facial. And then the infraorbital nerve supplies this aspect of the face, the upper lip, the nose, and the lower eyelid. The other deep sensory branches, palate is there, nose is there, pharynx is there, it's as simple as that. And the upper jaw is there. So posterior, middle, anterior, superior alveolar nerves. Greater and lesser palatine nerves, nasopalatine nerve, twixt to the pharynx, pharyngeal branch. And of course meningeal branches also it gives. That gives an idea of what it supplies in the middle third of the face. Superficial as well as the deep aspects of the face. Then comes the most important mandibular nerve, third division. 5-3 it's called. This nerve has got both sensory and motor components. Let me tell you about the motor component. Earlier we told about the muscles of mastication. So the motor component supplies about 8 muscles. 4 muscles of mastication and the accessory muscles which are also involved in mastication. masseter, temporalis, medial and lateral pterygoids, mylohyoid, the anterior belly of the digastric. Two small muscles are also supplied. The tensor tympani and the tensor veli palati. Devoted branches are there for these nerves, for these muscles, which together help us do the biting and chewing mechanisms. Now it has got an important sensory component also, in the form of buccal nerve, lingual nerve, and the inferior alveolar nerve. The inferior alveolar nerve is the nerve of importance for the dentist. He has to give local anesthesia and block this nerve's action for him to perform his office procedures, various day-to-day office procedures. The trigeminal nerve is also a victim of trigeminal neuralgia, a very distressing, painful disorder. Results in depression in many patients due to a variety of reasons, managed by a variety of medications, painkillers, opioid painkillers, anti-epileptics, sometimes by surgery also managed. Stereotactic surgery, decompression surgery, it's very distressing. The trigeminal vascular plexus also, a complex plexus of vessels are there, which are supplying these nerves. These are also implicated in these vascular headaches, migraine types of headaches, and so on. Such is the importance of this trigeminal nerve. You need not know all the details, all the branches, but if you know the topography of the nerves, the branches, you can as well derive the branches in detail as well. Thank you for listening. All the best. Once again, do not forget to exercise your likes and dislikes on my talks. The basic idea of these talks are to make anatomy and geography of the body very simple, very elegant manner. Thank you once again.